For any diagnostic system to be useful, it must be both reliable and valid. Reliability refers to the consistency of a diagnosis. Clinicians should reach the same conclusion across time. Test-retest reliability, and different clinicians should agree when assessing the same person. Iterator reliability. Validity refers to whether the diagnosis actually reflects a real disorder and whether the classification system measures what it claims to measure. A diagnosis cannot be valid unless it is also reliable. Iterator reliability is often measured using a kappa score, where 1 represents perfect agreement and 0 indicates no agreement at all. Scores above around 0.7 are considered acceptable. However, field trials for DSM-5 reported only moderate agreement for schizophrenia, with a kappa score below 0.5. Cultural differences in diagnosis. Research shows that rates of diagnosis vary significantly across cultures, suggesting cultural expectations influence clinical judgment. For example, one study comparing American and British psychiatrists found that Americans diagnosed schizophrenia far more frequently than their British counterparts when given the same case description. Cultural beliefs may also shape the content of hallucinations. Interviews with people diagnosed across several countries showed that individuals in Western cultures tended to describe threatening or hostile voices, whereas participants in non-Western countries often described their voices as more benign or supportive. This challenges the idea that certain symptoms are universal features of schizophrenia. Gender bias. Gender can influence diagnostic decisions. Some clinicians may unintentionally apply different standards to men and women. Earlier research found that typical descriptions of a mentally healthy adult often aligned more closely with male behavior, meaning women were more likely to be judged as showing signs of illness. Stereotypes about how each gender should behave can therefore distort diagnostic accuracy. Symptom overlap. Many symptoms associated with schizophrenia also occur in other mental health conditions. This is known as symptom overlap. For example, hallucinations and delusions can also appear in bipolar disorder, and speech disturbances may be present in several other conditions. Some disorders share so many symptoms that differentiating them becomes difficult. In fact, some research has shown that people diagnosed with dissociative identity disorder often display more schizophrenia-like symptoms than people diagnosed with schizophrenia itself. This overlap poses a major problem for diagnostic validity. Comorbidity. Comorbidity refers to the presence of 2 or more disorders at the same time. High rates of comorbid conditions among people with schizophrenia raise concerns about the validity of the diagnosis. Many individuals also meet criteria for depression, anxiety, substance misuse, and obsessive-compulsive symptoms. Since each of these disorders is relatively uncommon in the general population, their frequent co-occurrence with schizophrenia suggests that diagnostic categories may not be as distinct as classification systems imply.